Hello and welcome to this channel. In this video, we'll explore the ways in which childhood trauma can shape adult behavior, including the development of mental health issues, addiction, and relationship problems. We'll also discuss how trauma can be identified and treated, and provide resources for those seeking help. So, you might be wondering, what exactly is childhood trauma? Childhood trauma is a term used to describe any negative experiences that occurred during a person's early years. These experiences can range from physical, emotional, or sexual abuse to neglect, abandonment, or exposure to violence. While some individuals are able to overcome these traumatic experiences and live healthy, fulfilling lives, others may struggle to cope with the lasting effects of their trauma. Childhood trauma can have lasting effects on an individual's life. Children who grow up in homes where they do not feel secure may develop coping mechanisms to function day-to-day just to survive. Unfortunately, these coping mechanisms can lead to high-risk behaviors in adulthood, placing them at risk for illnesses such as heart disease and cancer. It's important to recognize that childhood trauma can have long-lasting effects and impact an individual's path throughout life, both physically and emotionally. The impact of childhood trauma on adult behavior. Research has shown that childhood trauma can actually impact the way our brains develop and function, increasing the risk for mental health disorders like PTSD and borderline personality disorder. It can also affect the way we form relationships with others, leading to challenges with intimacy and attachment as we grow older. But that's not all. Childhood trauma can also make us more likely to engage in risky and impulsive behavior, like substance abuse, self-harm, and risky sexual behavior. Trauma can also contribute to the development of addiction. Many individuals who experience trauma turn to drugs or alcohol as a way to cope with their pain. This can lead to addiction and further problems with behavior, including a loss of control over one's actions and an increased risk of engaging in dangerous or criminal behavior. Additionally, childhood trauma can have a significant impact on a person's ability to form and maintain healthy relationships. Trauma can make it difficult for individuals to trust others and form emotional connections. This can lead to a pattern of unhealthy relationships, including abusive or codependent relationships. There are many potential causes of childhood trauma, including but not limited to physical, sexual, or emotional abuse. Physical abuse can cause trauma in a number of ways. The physical pain and injury caused by abuse can be traumatic in themselves, but the effects can also be long-lasting and can impact a child's emotional and psychological development. Children who experience physical abuse may develop a sense of helplessness or powerlessness, which can lead to feelings of anxiety, depression, or anger. Furthermore, the long-term consequences of physical abuse can include changes in brain function and structure, which can impact a child's ability to learn, reason, and develop social and emotional skills. Overall, physical abuse can have long-lasting effects on a child's development and well-being, and it's crucial to seek help and support in order to address the trauma and promote healing. Neglect or abandonment by a caregiver. Abandonment can cause trauma in a number of ways. When a child experiences abandonment by a parent or caregiver, it can lead to feelings of fear, confusion, and loss. This can be particularly traumatic if the child has developed a strong attachment to the abandoning person. Abandonment can also have long-term effects on a child's emotional development, potentially leading to trust issues, difficulties with intimate relationships, and feelings of worthlessness or low self-esteem. Witnessing or experiencing violence or trauma, such as in cases of domestic violence or natural disasters. Witnessing or experiencing violence can cause trauma in a number of ways. The fear, helplessness, and confusion that come with exposure to violence can trigger the body's fight or flight response, which is the body's normal response to danger. However, repeated exposure to violence or trauma can cause the body to become overwhelmed and create physical and emotional symptoms associated with trauma. Children who witness violence may feel powerless and helpless, and may go on to suffer from symptoms of post-traumatic stress disorder, PTSD. Symptoms of PTSD can include intrusive thoughts, nightmares, flashbacks, avoidant behaviors, or a sense of emotional numbness. Furthermore, exposure to violence can also impact a child's cognitive and social development, potentially leading to difficulties with learning, relationships, and social functioning. Family dysfunction, such as mental illness or substance abuse issues. Family dysfunction, such as mental illness or substance abuse issues, can cause trauma in a number of ways. Children growing up in such environments may experience chronic stress, uncertainty, fear, or anxiety. They may feel emotionally unsupported and may lack a sense of security and stability, which can impact their mental health and emotional well-being. Medical trauma. Medical health issues can cause trauma in a number of ways. Patients who undergo medical treatment or procedures may experience pain, discomfort, or anxiety, which can lead to trauma or post-traumatic stress disorder, PTSD. In some cases, medical treatments or procedures may be invasive, causing physical and emotional distress that can impact a patient's mental and physical well-being. Additionally, patients who receive a difficult diagnosis or experience chronic or life-limiting illnesses may struggle with feelings of loss, grief, or despair, which can also lead to trauma. Medical trauma can affect a patient's quality of life, their social relationships, and overall health outcomes. Bullying or social exclusion. Bullying can cause trauma in a number of ways. The repeated exposure to the threat of harm, harassment, and intimidation that come with bullying can trigger the body's fight or flight response, creating physical and emotional symptoms associated with trauma. Children who are bullied may feel powerless, helpless, worried, anxious, or depressed. They may also experience feelings of shame, guilt, and social isolation that compound the initial distress of the bullying. It's important to note that each individual's experience of childhood trauma is unique and can vary widely depending on a variety of factors. However, identifying the potential causes of childhood trauma can be an important step in recognizing and treating its effects later in life. Identifying and treating trauma. Identifying childhood trauma can be challenging, as it may not always be obvious or immediately apparent. Some common signs of trauma include anxiety, depression, difficulty sleeping, and a tendency to avoid certain situations or people. It's important to remember that trauma affects individuals differently, and there is no one-size-fits-all approach to identifying or treating it. Treatment for childhood trauma typically involves a combination of therapy and medication. Therapy can help individuals process their trauma and develop healthy coping mechanisms. Medication can be used to address underlying mental health conditions that may be contributing to the trauma. There are also a variety of alternative therapies that can be helpful in treating trauma, including meditation, yoga, and art therapy. It's important to work with a mental health professional to determine the best course of treatment for your individual needs. Treatment for childhood trauma typically involves a combination of therapy and medication. Therapy can help individuals process their trauma and develop healthy coping mechanisms. Medication can be used to address underlying mental health conditions that may be contributing to the trauma. Additionally, there are a variety of online resources and support groups available for individuals seeking help. It's important to remember that seeking help is a sign of strength, and there is no shame in reaching out for support. Childhood trauma can have a profound impact on adult behavior, contributing to the development of mental health issues, addiction, and relationship problems. It's important to identify and treat trauma in order to prevent these negative outcomes and promote healthy behavior. Now, it's important to remember that just because you may have experienced childhood trauma doesn't mean you're doomed to suffer the consequences forever. Seeking help from a therapist or other mental health professional can be an incredibly positive step in recovering from the effects of childhood trauma and improving your overall quality of life. We need to work towards creating safe and nurturing environments for children to grow and thrive in, so they can continue to flourish throughout their adult lives. Thanks for watching. If you found this video helpful or informative, please give it a thumbs up and share it with someone who might benefit from this information. If you have any questions or comments, please leave them down below and I'll do my best to respond to as many as I can. Also, if there are any topics or ideas you'd like to see us cover in future videos, please let us know, and make sure to subscribe to our channel for more engaging and informative content. Thank you again for watching, and we'll see you in the next one.